Coextension of
That's related states. It means diseases and risk factors. Diseases and causes of disease. Okay? And what are 3W in descriptive epidemiology? Yes, please, lady. Whoever. May I ask you to explain me some factors related to who? Which characteristics of person is important for us? Yes, please. Yes. What are the most two important factors? Age and gender. Age and sex are the most important factors that we always you have to describe them when describing any status. Age and sex are universal. Other personal factors are related to the event. For example, for vitamin D deficiency in ladies and women, even religion is important. Because Muslim women usually have low exposure to sunlight, so they are prone to vitamin D deficiency. You know that the major source of vitamin D is sunlight.
Yes.
And exposure to sunlight is the main source for vitamin D. So for some diseases, such as vitamin D deficiency, such as rickets, rachitism, even religion is important. For some diseases that are related to consumption of subspecial foods, also religious habits is important. Vegetarians usually are not exposed to diseases that are transmitted by meat. So, age and gender are universal. Other factors are related to the outcome, the health status that we are seeking for them. Okay, we can go to the second session. We are just trying to talk about the dynamic of transmission of diseases. This is an old model that was called triangle.
Yes.
Triangle was common in early 20th century for explaining disease transmission. This model, we have three main bases in the triangle. The agent, usually a microorganism, such as a bacteria. The host, that is human, and some environment that needed to transmit the agent from a source or from a patient to another patient. This is called triangle. And in some cases, we also need a vector. What is the vector? For an example of a disease that needs a vector to transmit. You know? Who can explain me the mode of transmission of malaria disease? How we can get malaria?
from water. From water.
From water? No. Malaria has been transmitted by an insect, by mosquito, by mosquito bite. So mosquito bites people who have malaria and then transmit the parasite from sick people to healthy people. This mosquito or this insect is called vector. So vector is an insect that can transmit some special diseases such as malaria. I think you did not pass the parasitology course.
No.
No, okay. Maybe this semester or next semester when you are studying malaria, you will be more familiar with vector-borne diseases. Vector-borne diseases are diseases that should an insect be present for the transmission. I mentioned that this model was very useful for diseases that are produced by microorganisms. So for each infectious disease, we can think of a microorganism. What is the agent of brucellosis? What is the agent for tuberculosis? Both of them need a microorganism, a bacteria, to produce disease. For tuberculosis, Mycobacterium tuberculosis, or Bacillus Koch. I think you have read something in high school about tuberculosis or about brucellosis. It is not important that what is the agent for tuberculosis or for malaria or for... Yes. Yeah. But these cases are just examples. As I mentioned yesterday, I do not expect you memorize these things. These are just some examples. You may have heard them or not. Okay? So, the message of this slide is that for some diseases, especially for infectious diseases are diseases that are usually transmitted or produced by a microbe, a bacteria, a virus. We need an agent. We need a susceptible host. Susceptible means that he or she is not immune. If some people is immune due to vaccination or due to getting the disease in the past, is not susceptible, is resistant. People who are resistant cannot get the disease. And we need also an environment. May I ask you to explain me some environment that are needed or are usually responsible for transmitting diseases? Air, yes. Water? Yes. Food? Maybe blood? Maybe close contact. Some diseases are transmitted by close contact, by contact of the skin to the skin, directly, okay? So some diseases do not need an environment. They should be transmitted by direct contact between the sick people, the sick person, and the susceptible person. But many diseases can also be transmitted through an environment. Water, food, air, soil. Some parasites can transmit from soil. When you have contact with soil without, for example, putting a shoe, then you can get the disease. But nowadays, for non-communicable diseases, so we have communicable diseases or infectious diseases. Another definition is infectious. Infectious means that there should be an infection with a microbe. What about non-communicable diseases, such as cancer? Yes. Another diabetes. Hypertension. HIV is communicable because it needs a virus. HIV virus is necessary for HIV, so HIV is communicable. Pneumonia is also communicable. For pneumonia, we need a microbe. But for asthma does not need any microbe. What is the agent of diabetes? Or what is the agent of hypertension? is there any agent that is responsible for diabetes or for hypertension or for cardiac disease?
Yes, yes.
No, we don't have one agent. We have multiple agents. We call them risk factors or preventive factors. For example, physical exercise is a preventive factor for cardiovascular disease because physical exercise reduces the chance and the risk of getting disease. We call the risk factors and preventive factors determinants of disease. So yesterday we just talked about distribution of diseases, distribution of health-related states, and determinants. Determinants means a complex of or a combination of risk factors and protective factors. These factors are some traits or some factors or some behaviors that can increase the chance of getting the disease, and preventive factors are attributes, or traits, or behaviors, or agents, or material that exposure to them can prevent getting the disease. So for non-communicable disease, this model does not work
Yes.
because we don't need a specific agent.
And environment.
Even we may not need environment. For example, for genetic disease or genetic disorders, the causes of disease can transmit through maternal to baby, from mother to baby, without any need to environment. So this model, the triangle model, is very useful for communicable diseases or communicable disorders.
Doctor, regarding to your case, you said genetic disorder, but maybe when we have radiation also affect on fetal.
Yes.
So we have the effect of environment.
In fact, there is not a clear cut between causes of the disease. Some diseases are both genetic and at the same time need some components that are environmental. For example, you may know some people who smoke for the whole time of their life. You may know some people who smoke for more than 60 years, but they don't get cancer because there is also some genetic factors that predispose people to get cancer. On the other hand, you can find some people, some examples, who do not have exposure to cigarettes, but they can get cancer due to other factors, due to air pollution, due to genetic factors, due to old age, and many other factors. So we don't have any disease that is purely genetic or is purely environmental or is purely even infectious disease. How many people in the world have the agent of Mycobacterium tuberculosis in their body? Do you know? Which percent of the whole population are infected with the microbe that is responsible of producing tuberculosis? Guess. Give me a guess about the percent of people that are infected by Mycobacterium tuberculosis that is responsible for tuberculosis disease. 30% of population in the world are infected. In fact, if you are 60 people in this class, about 20 of you, 1/3 of you have the microbe of tuberculosis in your lung. I may have it. But none of you do not have any signs and symptoms of tuberculosis, because for getting tuberculosis, we need Mycobacterium, and also we need some immune disorders. If our immune system is intact, so we cannot get the tuberculosis. malnutrition means insufficient intake of food. Malnutrition means that the amount of food and the contents of food that are ingested are not sufficient. Malnutrition can increase the risk of getting tuberculosis. So in the new world, even infectious diseases or communicable diseases need some non-communicable factors, such as environmental factors. Food is environmental. Immune system is a genetic predisposition, it's genetic trait. Physical exercise, people who regularly do physical exercise are less susceptible to getting tuberculosis or other infectious diseases. So for non-communicable diseases, the complex or the situation is very complicated, more complicated than infectious diseases. Today we are just talking about infectious diseases because the infectious diseases are more important for us due to potential to produce epidemics. Epidemics, what is the epidemics? Epidemic. Okay.
Common disease or common disorder?
Corona is a common example for epidemics. We will discuss it. Let's go back. We have some host characteristics such as age, sex, race, religion, customs, occupation or job, genetic profile, marital status. Marriage may increase the risk of some mental disorders, or marriage may decrease the risk of some mental disorders. Some people, when get married, are at increased stress. For some people, marriage reduces the stress. Which one is more common? Gentlemen believe that after marriage, the stress will be increased. I don't know why. Do you agree with me?
What's your opinion?
Depends on. In epidemiology, when somebody asks you a question, please try to start your answer, it depends on something. You can get half of the score. Because any situation in epidemiology is dependent on something else. Okay? So if you don't know the right answer of a question, you can answer, it depends on. And then write something, it is not important. Many factors are interrelated. It depends on the, characteristics of the wife and characteristics of the other spouse. People who are, very active usually love the partner to be active. People who are very slow usually prefer the slow people to have communication with each other. So marital status is also a host characteristics. Family background is very important. Sometimes family background is related to genetic, and sometimes family background is not related to genetic. It is related to the food, because each food that my mother produces, all of the family will consume that food. If my father has exposure to, for example, a chemical in the occupation, in the job, he brings that exposure, he brings his closest to the family, and the whole family will have exposure to that material. So, family background may be due to genetic, maybe due to genes, and maybe due to environmental events. environmental events such as food, such as water, such as air, and any other materials that we have exposure. Previous disease and immune system are some important host characteristics that may increase or may decrease the risk of getting a disease. Agents may be biological. Biological means bacteria, virus, fungi, and parasites.
Yes.
These agents are called biological factors. Agent may be also chemical, such as poisons. Arsenic is an agent for cancer. Arsenic can produce cancer of lung, cancer of bladder, skin cancer. Alcohol is also a chemical poison. Smoke, tobacco smoke, or air pollution are some chemical or maybe physicals. Sometimes the physical aspect of air pollution is important. Physical means that particles can go to the lung and produce some diseases that is just due to their physics, just due to the shape. The shape of some particles are important for producing disease. But some particles in the air, their chemical, characteristics may be important. We have also nutritional exposures. Some people may suffer from lack of sufficient food, and in our societies, majority of people suffer from excess intake of food. The body mass index is very high in our society.
Yes.
Majority of people have body mass index, BMI. What is the formula for BMI?
Wasn't
The
it
weight
about
of
weight and
Weight.
long,
and the line,
You can divide it by
long,
long
height
other person.
up to 2.
But,
over 2. The body mass index should be something between 9 and 25. But majority of people in our class have body mass index more than 25. And this is just due to excessive intake of food or low physical activity. You can consume high amount of food, but with physical activity you can make a balance between intake and output. And about environmental factor, temperature. Some diseases are due to excessive heat.
yes.
Even in the season, the temperature in Karbala is higher than 40. It can produce heat exhaustion in some people, or heat stress. In the winter, low temperature can increase the risk of, for example, pneumonia, the risk of common cold. Common cold is a viral disease that is related to the temperature, due to humidity. Cities that are near the seas, the big seas, usually have a higher humidity, and higher humidity, rutubat. The amount of water that is in the air in the form of a gas is humidity. Higher humidity is, responsible for a higher risk of fungal diseases, for example. Fungal diseases. Fungal diseases that are produced by a fungus. We just talked about altitude or elevation from sea level in the example of cholera. So altitude, in higher altitudes, the concentration of oxygen is less than the lower altitudes.
High oxygenation.
Sorry? If you have any comments, please interrupt me and say, don't worry. If you have any comments, anything that is important to say at each time, please interrupt me and say your comment or ask your questions. Don't worry, it's not offensive for me. Crowding, housing, neighborhood, water, milk, food, radiation, air pollution, noise. Even noise is very important. Exposure to loud noise can increase blood pressure, can produce diabetes. Now, it has been well shown that noise can increase the risk of diabetes and risk of hypertension. In fact, in big cities, we are exposed to both air pollution and noise pollution.
So about noise, one noise or different noise?
It depends on many things.
We know that human can adapt to the noise.
Sometimes the fluctuation of noise is more important than the level of noise. If you are exposed to a high level of noise, but the noise is constant, there is less dangerous for you to the situation that we have a peak of noise in the middays and then reducing the amount of noise in the nights. So the frequency of noise is very important, the frequency of sound. Is it high pitch or low pitch? High pitch, like the sound of birds, and low pitch sound of cow. Low pitch, like cow, and high pitch, like birds. Horns, signal of the cars is very important. And also, we have the problem of light pollution. Light pollution means that at night, when you are asleep, you are exposed to high amount of light due to the light that comes from outside of the building, from the streets. Or there are some applicants in the home that produce light in the night time. Light is shown to increase risk of breast cancer. Excessive exposure to light at the night time, the sleep time, is related to some diseases. All of these factors are called environmental factors. The triangle model, that although triangle model is best fit for infectious diseases, it also may work for non-infectious diseases. But we know now that there are better models for non-infectious diseases. We will discuss them at the end of session about the causality, about the cause and effect. We have a session at the end of course that we will discuss how can we conclude that something is cause of something else. How can we find that something is the risk factor or preventive factor of a disease or of another state?
Doctor,
Yes?
light can be one of causes of breast cancer?
Yes,
Yes.
because light can alter the or change the there is a hormone that is called melatonin. Melatonin is related to exposure to light. In the night time, melatonin is higher, and in daytime, melatonin is lower.
From hypophysis.
Yes, from hypophysis. And melatonin is related to many hormones, many other hormones in the body, such as FSH, maybe LH, estrogen, progesterone. And estrogen and progesterone are two hormones in the women that are closely related to breast cancer.
So how about people who sleep in
The day.
wake up in the night and
They also are at a higher
even if
risk of
they
many
do that
diseases.
to enough times?
Yes, there is such as people who have a shift work. For example, a nurse that usually is awake in the night time and sleeps in the daytime. These people have problems with melatonin, and due to this exposure are predisposed to many diseases. But please pay attention, pay enough attention that there are many agents that should be collected together to produce a disease. Not one specific agent is responsible for breast cancer. I just talked that these people are more prone. The risk of getting cancer is higher. It may be slightly higher. For example, ordinary people may have a chance of 1 out of 10,000. It means that 1 out of 10,000 healthy women may get breast cancer. If they have some problems with this hormone, the risk may increase to 1.5. So the risk may be slightly higher. We will discuss about these issues next week. Don't worry about these issues. We are just talking that in the non-communicable diseases, many factors can have an influence on the risk of disease. Some of them may have a very big influence. For example, smoking is severely related to lung cancer. It has been shown that smokers are at a very high risk of getting lung cancer. But light exposure can increase the risk of breast cancer very slightly. There is still a relation between light pollution, between noise pollution, between many other environmental pollutions and some specific diseases or disorders. Okay. Turn back to infectious diseases. Our focus today is on infectious diseases. Infectious diseases are diseases that are more important because they can spread from one person to another person. And they can produce problems such as coronavirus disease or COVID-19 disease. COVID-19 is a good example of an infectious disease. For an infectious disease, there are two modes of action, two modes of transmission, directly and indirectly. Directly means that there is not any need to an environment. Just close contact is enough for transmission of disease, or in another term, without close contact, we do not have such diseases. So if we sit separately in a room, we can transmit a disease that usually are transmitted directly to another person. A good example of a disease that is transmitted directly is HIV/AIDS. If you live in a room that your roommate has HIV, you are not as at higher risk of getting disease. Because for transmission of HIV, we need a close contact. Not only close contact, but also sexual contact. It means that from skin to skin, HIV cannot transmit. It needs from mucosa to mucosa, such as in sexual intercourse. So, direct transmission is for diseases that need a high amount of microorganisms to go from the sick person to the susceptible person. Another example of direct transmission is transmission through ingestion, through injection of blood. If you need blood transfusion, and for blood transfusion, polluted blood is transferred to a susceptible person, the HIV or the HPV or HCV, HIV is responsible for AIDS, HBV is is responsible for hepatitis B or hepatitis C. Hepatitis means inflammation of the liver due to some viruses. So, by blood transfusion, HIV or hepatitis viruses can transmit. What about indirect? For indirect transmission, we need an environment. This environment may be air, maybe water, maybe food, maybe a common, a common vehicle, such as shaving machine. Shaving machine can transmit some skin disorders from a patient to a healthy person.
About direct, Doctor, how can HIV transition directly? We need something to go to the blood of us.
From blood to blood is an example, and in sexual intercourse, there are some viruses that transmit from the body secretions of the sick people to the susceptible person. So there isn't. We need close contact of mucosa. Do you know what is the difference between skin and mucosa? Mucosa versus skin. Skin usually has a barrier. It is called epidermis. Epidermis is a thick barrier that prevents penetration of microbes. But mucosa, such as the interior lining of our mouth or in genitalia, this apparatus does not have any skin, does not have a thick layer of epidermis. So the microbes or viruses can easily penetrate the body through mucous membranes. I repeat, these issues are not important to memorize. These are just examples. Don't worry that these issues may be unfamiliar for you. I try to bring you some examples. The concept is important, and is that some diseases can transmit directly, and some diseases need an environment. We call this environment a common vehicle. Common vehicle means something that is common between sick people and healthy people. Something that will be shared between these two people. Like bus. In bus, yes, you're right, but in bus, air is the common vehicle because we can breathe, and after sneezing or after coughing, we can, expel some particles in the air of the bus, and then some other people may breathe them. Or they can, some droplets that go out and sticks to the surfaces, and another person who touches the surface can transmit these viruses, and then by rubbing the eyes, eye also has a mucous membrane. Eye is very susceptible. By dropping a very small drops of the cough from sick people who has coronavirus to eyes or to nose or mouth of the people who are susceptible, disease can transmit.
Like doctor's tools?
Doctor tools is also a good example.
That is mean because indirect way do not need just host. Even without host we can
Yes.
host we can.
No. Host means that the healthy people. We need a healthy people. We need a susceptible people to get the disease, but we don't need a human being as a source. We don't need sometimes source. Yes. Some, tools that doctors use, such as a stethoscope, is not very important because a stethoscope for oscillation of the heart sound or lung sounds has a contact with the skin, and the skin is very has a very good barrier for the virus. But some apparatus for examining oral cavity or for dentistry are a good example of common vehicle for transmission of hepatitis B, especially hepatitis B can transmit through dentistry applicants or other applicants that are used for genital examination are apparatus that should be cleaned after examining a people to another, or endoscopy. Okay, for endoscopy, for watching the interior space of the stomach, after each endoscopy, the endoscope should be cleaned thoroughly for prevention of transmission of disease. A common vehicle may just have one or single exposure. Single exposure means that a restaurant that usually produces foods and prepares food, always the food is healthy, but just one day the food is poisoned. So every people that consumes the food of its restaurant at that time can be infected. But the day before and the day after, there isn't any exposure to the bacteria, because this is a single exposure. Multiple exposure means that a worker in a restaurant has a disease. Each day that he or she works in the restaurant produces some pollution in the food. The days that he is off or she is off of the work, there is no exposure. So single exposure means that just one occasion of exposure is important. What about continuous exposure? Can you give me an example of continuous
Like
exposure?
Animals have some virus, or we have a dog or cat,
Yes.
like rabies.
Please give me an environment that transfers continuously something to our body.
We can say the smoke of the car.
Smoking, yes, but the smoking is not continuous. Sometimes somebody may smoke in the car, and in other times nobody may smoke.
Radiation in hospital.
Radiation in hospital again is not continuous. You know that when you need an X-ray, there is no exposure to the radiation, but just in a small time there is a transmission of radiation and then it stops.
The employee of the restaurant have a continuous disease, it's continuous exposure.
Yes. And very easy example is air pollution or water pollution. When we have a source of water that is polluted with, for example, with a heavy metal. You know heavy metals such as arsenic, such as chromium, cadmium, lead. If in a village or in a city there is a well that the water of the well is polluted with the heavy metal, we have a continuous exposure to this heavy metal. Or when a restaurant uses a material that is polluted, for example, uses a wheat, that this wheat is polluted with some pesticides. Do you know what is pesticide? Pesticide is a poison that we use for killing insects. In agriculture, there are insects that, for example, some mosquitoes that can use our foods. So we kill them with the use of pesticides or insecticides. If the wheat is infected or is polluted, so whenever we go to that restaurant, we can ingest some amount of poison. We will discuss the importance of single or multiple exposure or continuous exposures in future slides. Is there any comments or any questions?
Yes.
Yes, please.
We talk about continuous exposure. For example, you said from people to people directly, but for example, the handle of this door.
It's a common vehicle.
Come on,
Yes.
not continuous.
It's a common vehicle
Common.
and it cannot produce continuous exposure because
Yes.
if I am infected, in some days I may touch the handle of the door and some days I may be absent. So it is not a continuous exposure. but it can produce multiple exposure. Whenever I touch the handle is infected, but a few hours later, the virus or the bacterium will be disappear because the viruses and the bacteria cannot live in the outside environment in a very long period.
Exactly.
After a few hours, usually all viruses or all bacteria can be killed spontaneously. So even for apparatus and devices that we use for medical examination, if you put them aside, after a few hours or a few days, they may be cleaned spontaneously.
So
Because
there is a dental microwave for dental tools. Put it in there by radiation and
by radiation or by heat
yes.
or by steam. Steam is better than
Radiation.
and that, yes, because for radiation, all aspects have to have exposure. If, for example, the radiation comes from this way, the other side are not exposed, but the heat or the steam can penetrate all aspects of the device. Yes.
So the doctor is too much exposure to indirect disease,
Yes.
and she should take vaccine, hepatitis vaccine.
Yes. The reason that physicians and nurses usually are suggested to get vaccination for hepatitis is that he or she is almost continuously exposed to many bacteria or many viruses. Before vaccination, she or he should put gloves, should use mask, goggles. Goggles are eye protection for protection of herself or himself from many viruses or bacteria from people who we are not aware of them. If we know that some people has a disease, we can isolate these people. But there are many people who have the disease but are in their incubation period. Incubation period means that the virus enters the body.
But not there.
There is the potential of transmission of disease, but there isn't any sign. There isn't any sign or symptom. Sign is that, for example, the patient does not cough. Symptom is that there isn't any complaint from the patient. So we think that he or he is healthy, but after a few days, you may get the disease.
Like
Non-clinical or preclinical. Yes. Yes.
So what do you mean by multiple exposure? We need multiple exposure to the same virus to get infected by this virus?
Both of this situation. In some cases, we need to have multiple exposures for virus or bacteria to accumulate in the body to produce the disease. But in other cases, just one exposure is enough. But in different occasions, we can, repeatedly be infected, and the infection may repeat. For example, you may experience gastroenteritis 4 times in a year because of multiple exposure to some viruses from food. Yes, thank you. I think there was another. Yes.
I say that like hepatitis. So that is how maybe patient take the virus that causes hepatitis, and after 2 months the signal short.
Appears. Thank you. I think in the last slide we will give you some examples of the incubation period of different diseases. Yes.
The HIV.
Thank you. Any other comments? Okay. So, as you have mentioned, some of your friends have mentioned, you have 2 types of disease, the clinical form and the non-clinical form. Clinical means that there is signs or symptoms. Signs are something that is evident for the physician, for the nurse, for the examiner, and symptoms are some feelings that are expressed by the patient. If there is sign and symptom, the prevention of a spread of disease is simpler because we can isolate the people from other people. By isolation, we can separate people who have signs of, for example, coronavirus. But the problem is that some diseases may be in preclinical phase. preclinical phase means that the virus enters the body, or the microorganism enters the body, it replicates, so the disease is produced. But the signs and symptoms may be later be evident. This is preclinical. Preclinical means that now there isn't any sign and symptoms, but later on the sign and symptom will appear. But what is subclinical disease? And what's the difference between subclinical and preclinical?
Preclinical before living disease. Subclinical
During
During
the clinic.
No. The preclinical is correct, but for subclinical, another definition may be correct. Let's ask another question. Which percent of people who are infected with coronavirus will show the signs and symptoms? If, for example, if 100 people are infected with coronavirus, just between 5 to 10% will show signs and symptoms, and 90 to 95% will never show any signs of symptoms. It means that I may be infected, the virus can replicate in my body, I can transmit disease to another people, and then I may recover, but without any signs and symptoms. Subclinical means that the signs and symptoms never appear. In preclinical, the signs and symptoms now are absent, but tomorrow or some days later may appear. So preclinical means that before clinical. Subclinical means that less than clinical. Subclinical means that the signs and symptoms never appear. And subclinical cases are the most dangerous cases for the spread of disease, because they don't have any signs and symptoms, and they will never show any signs. Yes, to
Like cancer?
no, the cancer. The answer is not wrong, but we are talking about infectious diseases, because cancer is not transmissible. Cancer, if in clinical phase or subclinical phase, cannot transmit from one people to another people, so it is not important for us. Our concern is about the tuberculosis or coronavirus, and you, I think.
Me, yes. Doctor, regarding to subclinical disease, in another explanation, we can say the virus or agent that is exist in our body, but is have not to produce anything that detectable by the examination, like HIV virus. Maybe it's
if it does not reproduce or does not replicate, there isn't any chance of transmission. So it is not important for us. It is it is called latent disease. In latent disease, the difference between latent and subclinical disease is that in latent disease, there isn't any replication of the virus in the body, so the chance of transmission is low. But in subclinical disease, the virus enters my body, replicates, produces, okay? And so my cough, my sneeze, my body secretions may transmit a high amount of virus to other people. And this can produce clinical disease in other people. The same amount of virus may produce a subclinical disease in my body and a clinical disease in an older people. Because old people usually have a less contact immune system. Old people usually has less physical activity. So subclinical is important because he or she is capable of transmitting disease without any signs and symptoms.
Doctor, in this situation, did the immune system know that? Know there is a virus inside the body? Or
Yes.
not?
Yes.
Why they don't attack?
The immune system, we have two types of antibodies. Some antibodies show just that there is exposure, okay? But this antibody cannot kill the virus or cannot kill the bacteria.
antigen, yes.
some another types of antibodies can kill. So, in technical terms, some antibodies neutralizing antibodies are the secretions of immune system that can kill the bacteria, okay? But there are non-neutralizing antibodies. The non-neutralizing antibodies are some reactions of immune system that can be measured by measurement of non-neutralizing antibody. Our immune system knows that there is some invasion of microbes, some invasion of viruses, and this indicator can show the infection. But these types of antibody cannot kill the viruses.
Then how we can kill it?
It's sometimes by helping immune system to produce neutralizing antibodies. In other cases, by prescribing some medications that has the capability to kill. Such as antibiotics. Antibiotics are not effective for viruses, are just effective for bacteria, but we have some antiviral drugs that kill the viruses. Yes?
So I have something is non-understandable. How would this virus or disease like HIV, I read in some sources it's maybe the symptoms not exist even 10 years. So how this virus still in our body without any something we can know?
The question is that for some cases of HIV, the virus may exist in body, for example, for 10 years without any signs and symptoms. Without any signs and symptoms means that our immune system are not so intact, because with interaction between virus and immune system, some signs and symptoms should reproduce. But if the immune system is less effective due to, for example, some medications. Nowadays, many people have organ transplantation. Okay? For example, kidney transplantation, or heart transplantation, or liver transplantation. After transplantation, we use suppress immune system by giving some medications, because immune system otherwise will reject the transplanted, okay? Or in many other immune disorders, we suppress the immune system. So by suppression of immune system, the interaction between virus and body is not a complete interaction. So the virus can replicate, but without annoying the body, okay? So in these cases, or in other cases, malnutrition can reduce the immune system. Stress can suppress the immune system. Yes? Yes? Yes.
So the subclinical is more dangerous than preclinical, because the preclinical, when you're infected by the virus, does not transmit. You feel the symptom is appear, like influenza. Influenza does not transmit to people, just only when sneeze or cough transmitted. While on subclinical doesn't it's transmitted without symptoms, like as to say virus.
You are right, but I will give more explanation after hearing.
Subclinical diseases. If we have disease, we have symptom or sign. You said subclinical disease without any sign and symptom. Then how we can find or discover if we have disease or not?
Okay, thank you for your questions. Let's start by there is a term isolation and quarantine. Isolation and quarantine. What is the difference between quarantine and isolation? Have you ever heard